My name is Alexander Seyf. I'm one of the co-founders and CEO of Autolomous. So my background comes from more technology and entrepreneurship. So majority of my tenure I've spent in starting companies, changing companies within the telecom industry and also finance and retail. Past 6 years has been within cell and gene therapy, which is a huge privilege for me. What Autolomous is about, we are in the journey of really helping the industry to progress to a better stage, to make it accessible, viable, and affordable for patients worldwide. The miracle of cell and gene therapy, it's life-saving, is increasing longevity of life and increasing quality of life for patients worldwide. And fortunately, we have a solution. Unfortunately, we all can be victim of the diseases going on and around the world. And I believe that we owe to the society to do our utmost best to bring cell and gene therapy to higher population. And we believe that today, using technology, it's standard and norm of cell and gene therapy. It's nothing good to have. We are beyond that point. It's a must. We need to have a better setting for us to manufacture, to reach out to patients and make it accessible, to bring economy of scale to this industry so you can reach more patients without any prejudice and bring more equity of access to patients worldwide. Originally, when we started with Autolomous, it was more concentrated on supply chain and manufacturing and everything around that. But our ethos has always been the patient. So bring the patient to the center of the universe of cell and gene therapy. And we have done 3 initiatives this year. One about the patient portal, so how we can inform the patients during the course of the therapy, what's the best part of the body, what's happening, and what's the treatment to incept, to act on hope, to bring hope to the patients that they are lacking that. And that portal will inform the patients about where the therapy is going on and what's the course of action around it, but also get a feedback from them during the therapy, how they are doing, because that is very pertinent for the physicians from clinical perspective, but also manufacturing when they're handling the therapy and manufacturing for them. The second initiative we have undertaken is about equity of access. So how we can increase the equity of access very objectively. So not based on a patient being in a close vicinity of a certain clinical trials institution or being close to a certain doctor participating in this, but give the equal chance to all the patients to be able to access this therapy wherever they are. So that will assist the clinicians to choose the right patient for the right clinical trials. And we call that for patient selection portal. And thirdly, what we are doing now is, and we're going to introduce it, commercialize it by middle of this month, is about helping the institutions and clinics and hospitals to bring the clinical trials in much better footing of informing the patients and the physicians about the clinical trials going on and what stage they are and what's the efficacy around it, if they're taking the patient in, and synchronize the information around clinical trials. The meeting in Mesa this year has been very enriching already from start. We've been here like 3 hours, but we see a lot of amazing people and really industry leaders. We see a lot of enthusiasm from the industry and a lot of hope and a lot of strong mission to really make a difference in this industry. So it's great to be here in Mesa 2024 in Phoenix.